Hello, everyone. My name is Alycia Welch, and I'm the Associate Director of the COVID Corrections and Oversight Project at the LBJ School, which I co-lead alongside Michele Deitch, one of LBJ's in-house criminal justice experts and the nation's leading expert on corrections and correctional oversight. Over the last 2 years, I've also served as co-instructor in some of Michele's classes, which has made my LBJ experience come full circle, as I'm also a proud alum of the school and a longtime advocate for criminal justice policy reform. My research focuses on the safe and humane treatment of people in custody, with a special focus on the distinct experiences of women, as well as individuals living with behavioral health challenges. I'm pleased to submit our latest report, The Pandemic Gender Gap, Meeting the Needs of Women in Custody During the COVID-19 Pandemic and Planning for the Future, in hopes that it will be included in the LBJ School's annual research celebration. This report is actually a part of a series of reports Michele and I have released on the impact of COVID inside of correctional facilities. That series gained national attention last fall with the release of our report profiling the number of deaths in custody due to COVID in Texas. Now our project is referred to as one of the major research centers focusing on COVID in prisons. Since the onset of the COVID-19 pandemic, corrections agencies developed strategies to try to mitigate the spread of the virus in prisons and jails, including the suspension of visitation and programming, restrictions on volunteers entering the facility, lockdowns, and the use of medical isolation. While these mitigation strategies introduce new challenges for everyone who's incarcerated, some of the measures have had a particularly insidious impact on women. Even before the pandemic, women are too often overlooked in correctional facilities that were not designed for them and are not administered with them in mind. As a result, prisons and jails exacerbate the factors that contribute to women's initial involvement in the justice system. The vast majority have higher rates of trauma experiences and unaddressed behavioral and physical health challenges, are single mothers, and are disproportionately from low-income communities of color. Our report, The Pandemic Gender Gap, examines the distinct harms women in custody experience during incarceration. It describes the ways in which the current pandemic exacerbated those harms, and it identifies gender-responsive approaches to mitigating the spread of the virus in correctional facilities that would simultaneously strengthen public health and improve safety for women, their families, and communities. My research for this report builds upon the work that Michele and I conducted as chair and member, respectively, of the Travis County Sheriff's Advisory Committee on the Women's Jail, which proposed a reimagined, gender-responsive facility for women. Michele and I co-authored a roadmap for designing this facility, and at the time, the County Commissioner's Court and County Judge, now State Senator Sarah Eckhart, used our roadmap to advance the county's plans for the women's jail. Our report also garnered national attention from prominent media outlets such as the Washington Post and the Marshall Project, and advanced a national conversation on gender-responsive corrections. The pandemic gender gap casts a wider net, applying the concepts of gender-responsive correctional supervision to all prisons and jails in the wake of the COVID-19 pandemic and over the long term in a post-COVID-19 world. The report has already piqued the interest of the nation's leading experts in gender responsivity, elected officials who are looking to change their approach to supervising women in custody, and several media outlets who have been reporting on the harms women in custody have been experiencing. For all of these reasons, I'd be honored for the report to be selected for inclusion in the annual research celebration at the LBJ School. Thank you.